Hello, and thank you very much for agreeing to answer a few questions today at the UK MDS Education Forum. So can I just ask you to introduce yourself and which hospital you're from or institution and the title of your talk?
Okay. Well, first of all, I'm very grateful to be invited to speak today at the MDS Day. So my name is Prof Fitzgibbon. I'm a research scientist and I work at the Barts Cancer Institute that's part of Queen Mary University of London. The title of my talk essentially was to do in relationship to familial AML MDS and whether it's more frequent than we actually might think at the present time.
Thank you. So can you now tell us a little bit more about the presentation you gave about familial MDS?
Okay, well, I think that the tools that are available to a researcher today is much better than it was 10 years ago, where we can sequence the genomes of the AML samples or the MDS samples and get a flavour of what are the genetic mutations that are actually present. It also is beginning to kind of unearth for us the possibility that there are rare but exceedingly significant numbers of patients that probably have a familial involvement, where there's a germline mutation that appears to predispose subsequently to the development of AML MDS. I think what we have at Barts, we've collected over 100 families where there's 2 or more affected individuals within a pedigree. We've sequenced those genes and we've started to identify both the known knowns, the genes that have been reported before, and they overlap with sporadic genes, but also a new set of genes that appear to be driving germline events and germline examples of MDS AML.
As an add-on question, when or why should some MDS patients be concerned about MDS possibly being hereditary or being passed on? Okay,
well, so I think that typically our definition of familial or inherited MDS is where there's 1 or more affected individuals within the same pedigree. Equally, if you have a germline mutation that's predisposing to MDS, the age of onset might typically be younger, and so therefore not necessarily in your late 60s or 70s, but potentially in your 20s, 30s, 40s or 50s. And I think they would provide clues if there's multiple individuals affected, and if the age of onset is early, that there might be a familial involvement. And then we can go on therefore and actually test and see whether specific known genes are actually mutated in your MDS and whether they're a germline origin or not.
Thank you very much. And as a last question, Professor Fitzgibbon, how would you explain what is a germline mutation versus a sporadic mutation?
Okay. So a sporadic mutation is just present in your malignant cells. So it's specific to the malignant cell and it provides a genetic fingerprint specific to the malignant cell. A germline mutation is actually present in every cell in your body. And so it will be present in your sperm or in your egg cell, and therefore it can be transferred on to the next generation. So that's this distinction between a sporadic mutation, which is present just in the malignant cell, versus a germline mutation that's actually present in all the cells in your body.
Thank you.
I think we got there in the end.